Thank you very much, and thank you to my friend from Oregon. I appreciate the opportunity to be down here today to talk about veteran care. This is an important issue that is not only critical to my state, but across the country, and as we know, it's been in the papers and the TV and on internet and everywhere else you can imagine. There are very few issues that we work on that have such a critical potential for impacting so many people when you think about it. These folks have sacrificed so much for us, our veterans, and now it is important for us to make sure they have the proper care for all their service. Of course, the VA system, all of the nation news, as I mentioned, everywhere you read, everywhere you turn, there's something about the system and what's going on. But I want to talk about Alaska's veterans programs that we're doing up there, especially around health care. And for me, veterans is a big deal. It's a big deal because Alaska has so many. And just to give you the lay of the land, we have over 77,000 veterans in Alaska. Almost 10% of my population of my state are veterans, serving this country in many different aspects throughout their careers and coming to Alaska to make it their home. Along with the 77,000 veterans across the nation, the VA has more than 11 million veterans registered or enrolled. Here's a picture of some rural veterans in Bethel, Alaska, which I enjoyed to be out there. And I have a story I'll tell in a little bit about the impact of some of the things we're doing in rural Alaska. I think of these veterans like my uncle, the U.S. Army infantryman Joe Begich from up in the Iron Range of Minnesota, who will be there this weekend on an honor flight from Minnesota. My family is very proud of his service and the service of my late father-in-law, Lou Benito, who was an Army colonel in Vietnam. We need to listen to their stories, not just on Memorial Day, not just the weekend that we're on the D-Day anniversary, which is this Friday, or we need to listen to our veterans every single day. They deserve to be heard, just as they deserve to receive the benefits they fought for. Make no mistake about it. When I hear from veterans, the vast majority love the VA healthcare system and what is being provided to them. I was in Alaska last week and met with veterans from all over the state. We do not have to wait for some headline or CNN to run some story about what's wrong with the VA system. My staff and I know what's going on with our care. We have regular meetings with the VA. Matter of fact, when I first came into the Senate, some of the first issues that we dealt with was VA and trying to make sure that the Veterans Administration is dealing with Alaska's unique situation of how diverse it is and how far apart many of these services are getting to our veterans. You know, when this issue started coming up on a national level this last week, and this last few weeks on the problems, especially in Phoenix, well, don't get me wrong, I'm outraged, like every American, every Alaskan is, about what was going on there and what probably is happening in other VA facilities around the country as we hear about more internal audits being done. But we saw this problem. I saw this problem growing in Alaska, and it was clear to me that it was inadequate staffing in Alaska. It was some other programmatic problems and systematic delivery system problems. What it meant was in Alaska, when I saw this problem, we had over almost 1,000 people waiting 2-3 months for their initial appointment to get VA healthcare service. This was unacceptable. So I convened a field hearing in Alaska to look at these issues and figure out what we can do to improve the system. Today, the average wait time for our VA veterans, our veterans in Alaska, to get their initial appointment is now down to 9 days. Matter of fact, the list, which we monitor on a regular basis from our office, is down to less than 2 dozen. That fluctuates from day to day, but from 900 plus down to a few dozen is an incredible system change. Now, we didn't sit around and wait, like I said earlier, about some story to bust loose or someone to get some bumper sticker out there or make some political hits. We saw the problem, we took action, and I was aggressive about it. I didn't sit around and wait for the Veterans Administration to come up with an answer. I participated, like my staff participated, because these results are real. Matter of fact, Alaska is a model on how to do this around the country because we figured out how to partner with folks around the state to make sure the highest priority, delivering health care, to our veterans was done, and especially in our very rural areas. I know, Madam President, you're like my state, very rural, small population, people spread all over the place. Trying to get into their clinic or their hospital for VA care is not as easy. You know, you're more fortunate, you have road access to a lot of your places. In our state, my state, 80% of the state cannot be accessed by roads. But we have veterans living all throughout Alaska who need desperately to get care. And we saw this problem. We didn't sit around and talk about it and do nothing. We actually talked about it, came up with a solution, and worked forward. When I ran for office, we called the Heroes Health Card. And then what we did is we modified it to make sure we could access all that we wanted to do. For example, here's a hospital, beautiful hospital in Nome, Alaska, way up north. Beautiful hospital. Indian Health Services. But our tribes run it. Incredible delivery system, one of the best in the country when you talk about healthcare delivery systems. Our Indian healthcare systems in Alaska are rated among the country one of the best. But I have 800 veterans, native and non-native, that could not access that care in that building. They live near it. They might live right here, but they couldn't go there. They had to fly hundreds of miles to Anchorage to go to the clinic, and if the service wasn't there, they'd have to fly to Seattle. Outrageous. 800 veterans. So what did we do? We sat down, and I dragged General Shinseki out to Alaska, to some very rural areas, to give him a little experience about what was going on. Nome, Alaska is up north here. Anchorage is down here. Seattle is even on the map, because they're kind of small anyway. They're not like Alaska in size, but that's a lot of distance. This is hundreds of miles people have to travel. It was not right. So what we do, we partnered with our Indian healthcare services delivered by our tribes. Incredible care. Instead of just here and here, it's now everywhere that they can access. So that means the veterans have a choice they did not have before we put this program into place. And it's unique to Alaska, and only in Alaska right now. But those 800 veterans now have a choice. They can go to Nome, or go to Anchorage, go to Fairbanks, go down to Seattle if they want. But they get a choice now. They don't have to fly hundreds of miles. And what does this do? It saves money to the VA system, not paying for those airfare, and guess what that goes to? Health care for veterans. And I'll give you an example. That earlier photo we had up here with all those veterans in Bethel, that was a couple years ago. And I remember telling them about this idea we were trying to implement. And, you know, they were a little skeptical, and they didn't think it would really work. And this weekend, I'm in Bethel, Alaska, in the same VFW hall. This one guy pulls his hand out, shows me all these scars on his hand that he's getting work done on. He says, I had to go to Anchorage to get this done. I thought he was going to get mad at me because that's where he had to go. And then he says, but now, these are the Bethel folks up there in the post. Now, he can go right down the street to get his therapy on his hand. And you know what he said to me? He said, Mark, I'm able to save my airfare and give more care to my brothers and sisters who served with me in the military. Because he doesn't have to fly to Anchorage. He gets a choice. He gets to get the care right there. And we went after this issue aggressively because we knew these veterans fought for our country and deserve the best. And we knew we could offer it in this system. The other thing, we've been aggressive as a member of the Veterans Committee. We've been aggressive about putting more resources to the veterans, the VA organization. Just in Alaska, in 2010, we had about a $160 million budget. Today, it's over $206 million in 4 years. Why? Because we're implementing programs that have success, that work, that deliver care. Is it perfect? No. Is it better than what they had 5 years ago? Absolutely. We didn't, again, sit around. And it's always amazing to me around this place. Suddenly new ideas pop out because they read about it in the paper. Well, do your work. I did. We're getting results. Care is better today than it was 5 years ago. Veterans, and that one veteran was incredible because, you know, Madam President, you know what it's like when you out traveling, you're meeting your constituents, they're going to say things to you and you're not sure they're going to be very nice and friendly. And he was a little intense about it, but when he showed me his result, I told him, I said, I want to take a picture of your hand because that hand is the result of the work we are doing. To take 1,000 people off the primary list of waiting down to a couple dozen. Instead of waiting 120 days, 8 days. Matter of fact, when you are enrolled in our delivery system in Anchorage through our tribal delivery system or our community clinic there, you could potentially get, the likelihood is, same day. You walk in, you get service. No delay, because we have a system that's maximizing our federal resources. All those are paid by federal tax dollars. Why not use them? Use them for the betterment and making sure that our veterans have the care they need. There's a couple other things we could do right now. And I've written to the VA about this, and that's, for example, we have public health doctors, public health service doctors that work in the Indian Health Service programs. But they're not in the VA. They have the ability to do it under Title 38, I think it is. They just have to make it happen. This is important because we have over 5,000 of these folks in many different professions serving our country. Let's put them to work even more. They're working hard now, but maybe we could deploy them in little ways to help our VA. I also support the proposal that Senator Sanders' bill to increase loan forgiveness for these folks who want to participate in our public health service. I've just introduced, and I know Senator Pryor introduced a bill that would increase important psychiatric services for vets through a pilot program, offering loan forgiveness for a gap in our service. We don't have enough. Well, one thing we also did, just to tell you another program we did for our veterans in rural parts of this country, what did we do? Because sometimes the copay for accessing telehealth medicine is enough to tell people, I don't want to do it. I had a bill on the floor, or a bill that I introduced, but again, General Shinseki decided just to do it. So now there is no copay if you want to access mental health through telemedicine. Why? Because it is proven to be very successful. In remote communities like your state and my state, we want them to have access to this mental health service. We have a limited amount of mental health doctors. So why not create an opportunity to use technology, limit the cost to the VA or the veteran, and give them the services they need? It's critical. Now, as I said it earlier, what happened in Arizona is unacceptable. And if it continues, we see other pieces where these lists were falsely put together, then people need to be held accountable and prosecuted. But just dealing with that does not solve the problem. Solving the problem means being innovative, thinking out of the box. And I have to say, Madam President, if you can do it in Alaska, in the most remote area of this country, you can do it anywhere. And we have a model that's working. We have veterans that like their care. They love their care. They have access that they never had before. It is important that we figure out a solution here. I know Senator Sanders' bill is an important bill. I hope we have it on the floor and we can debate it, and hopefully we'll get to a bipartisan. Because as you remember, this bill failed before. A few votes. They complained it cost too much. Cost too much. These are veterans who served our country, who went to war for us, to be in this chamber, to be able to have free education in public education, to be able to have an incredible country here. You're for veterans or you're against veterans. It's not a complicated issue here. The bill that failed told me where some people were. Some were for veterans, some were against veterans. You know, we had 2 wars unpaid for, trillions of dollars. Now it comes time to pay the bill for the people who have served our country, and we debate that we can't do that. But we're going to have a bill in short order on providing all kinds of tax extenders, you know, for horses in Kentucky to get special tax breaks, but we're not going to pay for that. We're not going to pay for that. But when it comes to veterans, oh, got to pay for that. No, you know, it's too bad. No. When that bill comes forward, it is time to see who's for veterans and who's against veterans. It's not complicated. Because if again, that tax bill, special deductions for horse racing, we're not going to pay for it because somehow horses are important. Veterans are important. This is who we should be taking care of. And complaining about what it will cost, they have paid the ultimate price. They've served our country. And the people who are not coming back have served and paid the ultimate price. So, Madam President, you know, my poor staff, I know they look at me sometimes because they're wondering where I'm going with my presentation here. But I get pretty outraged about this because in Alaska, veterans is an important issue. This country, it's important. And for us to debate how, you know, the few couple billion or a few hundred million that we're complaining about some people have, we spend $2 trillion plus on wars. It is time for us to pay the debt to these veterans. I know we're going to have a hearing this week in the committee. We'll be working on the bill that Senator Sanders has put together and I participated in, like every other member of the Veterans Committee. It is time to do the right thing here for our veterans. Madam President, I appreciate the opportunity to be down here, and I think that as an Alaskan that recognizes the importance of our veterans, I do believe everyone in this chamber recognizes the importance to our veterans. But they will have a chance. They will have an opportunity to decide, are they for veterans or they're against veterans. If they come down with these convoluted Washington, D.C. doublespeak about how they can't do the bill because of this or that, that's just what people are fed up in this country. I know when I go back home, they just ask me a very simple question. Can we get better health care for our veterans? Can we access the GI Bill that makes sure they get an opportunity to get better education? Is there an opportunity for them to take their skill they learn in the military and put it to work to get a job? These are the things that we should be fighting for. But I have a feeling we'll be down here with some members quibbling over some small detail because they really don't want to pass the bill. Again, you're for veterans or you're against veterans. It's not complicated. Madam President, I yield the floor.